Good morning, my name is Almas. Today I'm talking about generic versus brand drug. The purpose of this topic is to pursue and encourage the audience about the economic benefit of using generic rather than a brand prescription drug. The specific goal of my talk is to share information that will help patients make informed decisions when it comes to choose between buying brand expensive or generic, still effective as the brand but much less expensive and affordable. In the United States, the cost of prescription drug, particularly brand drug, have been skyrocketed, and many low-income patients cannot afford buying them. Patients have much less power and control on prescription drug price because the manufacturer or branded drug is one sets the prices and controls the drug market. How many of us believe and thought generic drugs are less effective than brand? Americans spend billions of dollars on branded drugs unnecessarily each year. Brand medications are very expensive, especially for uninsured and patients who have low income. Today, I'm talking about similarity and differences exist between generic and brand name. Most of we know the price of branded drugs are expensive and unbelievable for many low-income class of our citizens and millions of Americans who are insured. This is unfair, and the government, drug manufacturer, hospital, health insurance company, and the public need to work together to find a solution to help patients to get help they need and help United States government save $billions unnecessarily. I am quite sure some of you in this audience have experienced the huge price difference between generic and brand at the pharmacy counter. Most of us here had to make the hard decision on which to buy, brand or generic drug only, because the price of this medication are forced upon use by the pharmacologist. The public need to inform about the similarity and difference between branded and generic drug. The Food and Drug Administration describes generic drug as copied as brand drug. Both have the same dosage, route of administration, precaution, quality, side effect, and contraindication. The major difference in the generic and generic drugs are only cheaper because the manufacturer do not directly bear the expense of developing and marketing the drug. When a company brings a new drug in the market, the firm has already spent much more money. A patent is an exclusive right given to the developer of the new drug is granted that given the company is exclusive right to sell the drug for the period of the patient is in effect. In this hard economy, who wants to pay more money for the richest pharmacologist company? Personally, I'm not willing and I can't afford either. For example, the price of Allegra, $17.99 brand, generic is $11.99. Tylenol, brand is $9.49, generic $2.39. The price of branded drugs have reached a point where many of us are unable to afford, and the potential impact of high drug prices of the patient's ability to afford has reached a point of national crisis. The time is now for the government, health insurance company, and pharmacologist company to work together towards affordable drug. For most part, generic have the copied of brand name and have exact or similar ingredients. Collectively, they can find a solution to control skyrocketing price on branded drug, and the US government and Congress must need to intervene. The government intervention to address the rising cost of prescription drug, including 1. Drug companies need to have a transparent and clear guideline when setting the prices on branded drug. 2. The government must have oversight over drug manufacture. 3. The excessive number of participants along the supply chain of drug needs to be completely eliminated so that the cost of drug delivery along the supply chain can be reduced by so-called middleman. Reference: Center for Drug Evaluation and Research, generic drug. Center for Drug Evaluation and Research, about the Center for Drug Evaluation and Research, Office of Commission, press announcement, and patient prescription of drug medication and patient prescription of generic medication, April 1921. Thank you.